Hello, I'm Deirdre Crochman Rose of New Insight Integrated Health Service, and welcome to Balanced Living. At New Insight Health Services, our approach is to deal with our clients on a holistic level. Today, we are focusing on food allergies. The month of May not only recognizes Mental Health Month, but also Allergy Month. This week, we are focusing on food allergies. Today, my guest is Miss Tanisha Foster. Tanisha is a health educator and food allergy consultant.
That's right.
Welcome, Tanisha.
Thank you, Deidre.
All right, Tanisha is here to talk to us about how her journey began as being a food allergies consultant due to having a child that suffers from food allergies. Her son's food allergies also helped to create a new and astounding business called ChopFriendly.
That's right.
Now, Tanisha, can you sort of walk us through your journey and first of all, understanding how you became aware of what food allergies are, and also using your background, how it helped you to deal with or navigate through the process of helping your son?
Certainly. So you're correct. By trade, I am a health educator. I received my Master's of Arts in Health Studies and Health Education from the University of Alabama. But having my son, I initially wasn't thinking about my medical background or my education background in terms of helping him. My first thought was, how am I going to be the best mom? How am I going to help my son to navigate through these challenges? When my son Carrington, affectionately known as Chop, hence ChopFriendly, when he was just out a year old, a few months before he turned a year old, we decided to transition him from breast milk to solids. And we decided to have a social outing with a friend and her children. Well, instantly, after consumption of his ice cream, he started to experience anaphylaxis, which is when different systems in your body goes into a way to protect itself, causing it to shut down in an effort to dispel this allergen or this exposure to a foreign substance. Fortunately for us, we were right next door to the pharmacy. We were able to administer Benadryl and to give him some treatment quickly. For me, when we had that first diagnosis and I found out that he was allergic to 10 plus different foods, my first mindset as a mom was, how is this going to affect my child? Not just physically, but how is this going to affect him socially? How is this going to affect him mentally? How is this going to affect his whole quality of life? So for me, ChopFriendly started because in efforts of me making sure that my child didn't miss a beat, making sure that he could still go through life and feel that he was still loved, still supported, and that he was going to be safe. And that's how we got started, honestly. Me wanting to make sure that my son had the very best. We always think about how we want our kids to have the best in life, the best place to live, and to be in the best schools, but we don't always think about how our kids are developing emotionally. And that was important to me from the very beginning. I knew that I didn't want this stigma to be placed on him and for people to box him in. Because one of the philosophies that our family holds to is you can do anything. And I knew that Kent just could not be a part of our equation. So I had to figure out, how are we going to make sure he is thriving? And so ChopFriendly became about, let's show people who are in our community, in our space, how to accommodate him. You want pizza? We're going to make sure you can have pizza. We're going to find a safe way to introduce it to you. You want ice cream? How are we going to find a safe way to introduce ice cream? And that's how we got started to support CHOP. And we discovered that there was a big deficiency, a big gap, education gap, in not just our family, but other families who were receiving new diagnoses.
Okay. And so I hear throughout your story, you are about how to take care of my son, how to protect my son, how to support my son, how to keep him going. But the question arises, how were you able to find that support for yourself? What tools that you have to help you deal with the stresses? I mean, just being a parent alone comes with its own set of stresses, but now we have these outliers, these extraneous factors that can cause us not only fear, it can create anxiety. There's sometimes there's a sense of helplessness. Can you share with me what that journey was like for you and your husband?
Certainly. Unfortunately for us, we didn't have a playbook to go by. Our allergist looked me straight in the face and she said, "Poor baby, I guess you'll just have to give him baby foods forever." I walked out of there feeling frustrated, anxious, and thinking my child can't develop properly eating jar peas and jar carrots. And so, unfortunately, we didn't have a playbook, but thankfully, I serve a God that says I write the plays. I just fell into it. I quickly got in the car, I prayed, I called my mom, I called my mother-in-law, and I just said, "Hey, I'll explain more in detail later, but I just need you to stand in agreement that we are going to figure this out, that God has already mapped out the plan, but we'll discover what this plan is." And I walked through the aisles, tears rolling out my face, every aisle in Whole Foods, reading labels, understanding what the labels meant. And then I remember, wait a minute, I have some training in me. I have a foundation, a basis for where to start. And so I went for what I knew. And I'm grateful that I was able to, everything that I was trying to do for my son, I was able to do it for me too. My point or my goal has always been for him to feel that he could do anything. So I had to remember that for myself. I feel helpless, I feel defeated. I don't know how we're going to do this, but I had to remember that I can do anything too. I can keep him safe. God called me to be his mom. And so that means that he's going to give me the tools that I need to make this happen for him.
All right. So if someone...
That's all.
Sorry.
Bright light.
This is going to be making noise, so I'm going to shut this. It's trying to cool itself off. So, alright. I think we're good.
Am I okay? All right. So I think you're correct. And the first thing, when we are talking about dealing with stress, normally we think about, okay, I'm overwhelmed. I need to find a way to calm myself down. And we would talk about using our tools such as breathing, taking a pause, counting to 10. Those are always very effective tools. And sometimes just stepping back from the situation. But then this situation did not go away for you. It was something that was still there. It was still present. So that's where we have to look at what other tools are available to us to help us when the crisis or the situation is ongoing. So I like that you were able to start using education and information as a tool for you, because that helps you to empower yourself, because knowledge is power. knowing that you can now start learning how to manage the situation. Sometimes during stressful times we feel helpless, like we have nowhere to turn. But we have to find a way to create our paths. And in Tanisha's case, she decided to go to the different stores, looking at labels, learning to understand labels, helping her to understand what her son was dealing with. And this, I'm sure, you found comfort, or were you able to, did you find that it helped to relieve your anxiety about the situation, or what happened?
Oh, definitely. I felt more empowered, not just because this information was just already sitting here, but whenever I could call a doctor or call a nurse and ask questions, getting answers to my questions empowered me. Asking nutritionist questions and even working alongside of them to make recommendations of what I thought would be beneficial to my son, because I had to recognize too that we were a team and they weren't the only ones responsible for his care, and I wasn't the only one responsible. We had to work together to come up with a plan that was going to work. But definitely, I think I just felt empowered when I realized that I had access to access to answers for my questions.
Okay. Right. And I know even for some people who deal with food allergies, and you can tell me if this was a issue for you, that after a while just being around any type of food can cause you to have experience forms of stress and anxiety.
Oh yeah, definitely.
You're never really sure if there's something new that has come up, or if this can cause some type of deathly or fatal, I should say, impact. And as a parent, did you ever experience any of those feelings?
Definitely. And as a parent, I still feel like that some days. So I have to always center myself and reposition, because the truth of the matter is I know what I'm providing. I don't always know what manufacturers, how they're packaging foods. I can only go only assume that they're following protocol and standards, but I'm not there to watch. So a big part of navigating this for me is trusting the Holy Spirit. And I don't know if all of our audience believe in, God or higher power, but I do. For us, I have to be very vigilant. Even in the beginning, I remember the first time I heard Chop have a potato chip and not have a reaction. That was the first time he didn't have a reaction to something I had given him. Because up until our diagnosis, whenever I would try to introduce a new dish, there would be hives, or he would be itching or blistering as a result of foods that I would introduce to him, until I learned how to read the food labels and to be able to scrutinize every detail of the label. But I still remember the sound of that first crunch from a quinoa barbecue potato chip. And as soon as I heard them crunch, I remember just feeling anxious, because up until that, in that moment, I'm thinking, okay, I think we may have this figured out. And then when I heard him eat the chip, and he laughed and he just kept on that potato chip, I felt relief. I felt like, okay, so we like this chip. This chip is safe. We're going to get more of those chips, because we can have chips. The first time he had an ice cream cone, a successful ice cream cone, I remember the look on his face, like his eyes were big, his smile was just big and bright. And for me as a mom, it's like my son can have ice cream and enjoy it, and it's safe for him. So I feel like myself, not just me, but for other food allergy parents, you go through a cycle of emotions. There are moments when you're nervous and afraid, especially when they're not in your care, and praying that that everything is safe and well, and then having feelings of euphoria when you see your son or your daughter able to enjoy life the way you're enjoying it and the way everybody else is enjoying it. And so I feel like it's a constant cycle of these different emotions.
Okay. So tell me, also we know that it's important when we are trying to help ourselves to find ways to advocate. What are some ways that you were able to advocate for your son? And then also, I understand that you have another child.
I do.
And so, what was happening when you had you have a daughter, correct?
I do.
And when you had your daughter, what were the fears?
With my daughter, we wanted to be careful and to be certain that she wouldn't experience the same things that her brother had experienced. And when we had the green light that she wasn't allergic to any foods, we thought educate in the same ways that we were making him be able to self-advocate and to be aware, we needed to make sure people around him could speak on his behalf too, including her. And so she has been a blessing, and from the very beginning opening herself up to learning about foods that could be, potentially harmful to her brother.
Okay.
But I'm not just a mom to him, I'm also a mom to her. So I've had to consider the ways that this food allergy diagnosis, how it may affect her as well. And so then I wondered, how would she feel if she couldn't participate in certain activities if he was there, as a means to protect him. But we're blessed because she's always been very much like his biggest advocate. Not if he's not enjoying certain foods, then she assumes the responsibility that, hey, I don't want it if he can't have it. And she's been, even great at even offering suggestions of things that we can do in the place of it. Hey, for an example, well, since we can't have pizza with the rest of the crew, can we go and play kickball together? Just finding different ways to support him.
Wow.
And I think by her learning how to advocate for him, it's made him a happier child. To understand that, hey, I know that somebody in here has my back. I don't have to just do this by myself. That when mom's not here, my sister's gonna look out. If my sister's not just here, my dad's gonna look out. So he understands just having people to speak for him. But even going back to the advocating part, you asked me what are some of the things that we do to ensure it. In the beginning, we didn't eat out at restaurants because it was too risky. And then when we started to step out and to try to experience new foods, because we still wanted to nurture the adventurous side of him. He's very adventurous, love to try, go new places and try new things.
Okay.
So one of the things that I was very adamant about doing is being taken seriously from the beginning. And whenever I would go to a restaurant, I would always ask to speak to a manager or to the chef who would be directly handling our food, because I wanted them to look me in my eyes and see how important this was to me. I didn't want to send word by a third party. I want you to look at me and see that I'm a concerned mom. I'm patronizing your store, and this is my child. I want us to walk out of this store the way we came in. And so that's been a big piece for us, being confident in speaking up. Because sometimes the world, they're not always supportive of what you got going on, what you have going on, but honestly, when it's a matter of life and death, you have to demand that they understand. And that's always been our mission. I'm not asking you to take this seriously. You're going to take this seriously, and teaching them to be just as assertive about it too.
Okay. And because also we are acknowledging the month of May is Mental Health Month, and during this COVID pandemic, there are numbers that showing that people stress levels and anxiety is off the charts. Was there ever a time during this pandemic and having to have a child dealing with food allergies and knowing that at some times there were times when the grocery stores were just clean, the shelves were just empty. It was hard to find different foods and ingredients for dishes, just period. Sometimes you could walk into a store and would have to turn away. Was there a period of time during this whole stressful, I should say, it's just been just off the track during the pandemic, where you started to, your anxiety level, your stress level, or just your fears started to increase out of the fact of knowing that he had to have certain foods, and if you were going to be able to find them or not be able to find them.
Definitely, for sure. I remember, so typically when we shop for our family, I replenish like fresh fruits and vegetables, like our produce, things like that, weekly or bi-weekly, because our diets focus a lot on healthy eating, and stock items like nut butter substitutes or even breads, things like that. I usually buy those in stock and just freeze things, or like packaged foods, we keep them stocked away. So initially during the pandemic, I hadn't been into the stores because I had already done my shopping, and then we got word that we were going to do a safe at home, the plan that the governor put in place. So when I walked into the store and I saw how bare the shelves were on the inside, I freaked out. And it was almost like I had just got a diagnosis all over again. How are we going to do this? What if there's no food available? And I had to quickly just get control over my feelings and my emotions, and realize that I was in control. That again, there were already tools available to me. And the good thing is most people were stocking up on regular food items, but people weren't looking for nut butters substitutes. They weren't looking for gluten-free bread to stock up on. So that was kind of a good thing for us, because I was thinking, good, at least we have some things that are available. But when items would become more scarce, then people would turn to those items. And that was scary for us because we didn't have other alternatives. If we did breads, we had a fewer selection that we can choose from, versus being able to just pick up bread on the shelf. And we had to be very intentional about that. So we started a garden right around the time COVID came, because my thought was, if it's not on the shelf, we're going to get it out of the garden. We're going to survive this pandemic. But yes, definitely, like the mental anguish of that, it's hard to even put in words.
Yes.
When you are walking through the aisles and you're hoping that you can find something that's safe.
Well, thank you, Tanisha, for being on Balanced Living today. It's been such a pleasure and definitely very informative. Now, if other parents who are in your position, or maybe parents with new diagnoses, wanted to reach out to you and just for some moral support or information, how would they be able to contact you?
They can go to our website, www.ChopFriendly.com, and they can book a consultation with me. If they have any questions, they can contact us, and we can get an idea and assess where what their needs are.
Okay. So thank you for joining us here on Balanced Living. And again, if you need to reach out to Tanisha to get some information about advocating for yourself or for your child, you can contact her at www.ChopFriendly.com. And if you need any information on how to deal with your stress, tools, please feel free to contact us at newinsighthealth.com. ChopFriendly.com. Thank you.